Welcome to the Global Men's Wellness Podcast. Today, we're looking into a really important area, erectile dysfunction, or ED. It affects so many men across the globe.
It really does. Millions.
And while many know about the common treatments, the usual pills, there's a whole group of men who just can't use them, maybe for safety reasons or because they don't work.
That's right.
So what happens then? Are there other options? Is there maybe something effective that's just flown under the radar?
That's exactly the gap we need to talk about. We're talking huge numbers here, maybe 10, even 20% of men worldwide dealing with ED. And the projections suggest that could hit, 322 million men by 2025? It's staggering.
Wow.
And you mentioned the common treatments, the PDE5 inhibitors, think Viagra, Cialis. They've been game changers for many, absolutely. But like you said, a big chunk, maybe a quarter, perhaps even a third of men, either don't get a good response, or the effect wears off, or crucially, they just can't take them.
Why not? What's the main issue there?
The biggest one is drug interactions, specifically with nitrate medications, often used for heart conditions like angina. Taking PDE5 inhibitors with nitrates can cause this sudden, really dangerous plunge in blood pressure. It's an absolute contraindication.
Okay, so that rules out the most common option for a whole group of men right there. That leaves them in a tough spot.
It absolutely does, which highlights the real need for alternatives.
So if those frontline pills are off the table for potentially millions, what else is there? This leads us to something called apomorphine. It sounds familiar, but maybe not in this context.
Yeah, apomorphine. It's quite different from the PDE5 inhibitors.
How so?
Well, those PDE5 inhibitors, they work mostly on the blood vessels in the penis, helping with blood flow. Apomorphine, on the other hand, is what we call a central dopamine receptor agonist.
Central, meaning it works in the brain.
Exactly. It acts primarily on the brain, stimulating specific dopamine pathways in a part called the hypothalamus. You can kind of think of the hypothalamus as a key control center for sexual function in the brain. So apomorphine basically triggers the erection process by acting on that control center first. There's maybe some minor peripheral action too, but it's really a brain-first approach.
That's fascinating. So it's flipping a switch upstairs rather than just working on the mechanics downstream.
That's a good way to put it.
So given this completely different central way of working, how effective is it? Does it actually work compared to, say, a placebo? Is it a real option for guys?
Oh, absolutely. Its effectiveness and safety have been looked at pretty closely. There was a big systematic review, pulled together data from 9 randomized controlled trials. That's over 3,000 men involved.
Okay, that's substantial.
And it consistently found that sublingual apomorphine, that means dissolved under the tongue, is definitely more effective than placebo. In fact, 8 out of those 9 studies showed apomorphine led to significantly more successful attempts at intercourse. We're talking somewhere between 6% and 27% more successful attempts compared to the placebo group.
That sounds like a noticeable difference for someone struggling.
It points to a clear benefit, yes.
Yeah. What about those overall erectile function scores? The questionnaires men fill out. Did it improve things in a way that's considered clinically meaningful?
Yes, generally those scores improve too. For example, one study with a 3 milligram dose showed about a 30% improvement from the baseline. That translated to roughly a 4-point average improvement on the standard scale, the IEF International Index of Erectile Function.
And is 4 points considered significant?
Generally, yes. A 4-point change on that scale is often seen as the threshold for a clinically significant improvement, something the man would likely notice as a real difference.
Okay.
But, and this is important, the level of improvement wasn't always hitting that 4-point mark for everyone. For certain groups, like men with diabetes or men who'd had a radical prostatectomy, the average improvement was sometimes a bit less than that benchmark.
So its impact might vary depending on the underlying cause of the ED or other health factors.
It seems so. It suggests that while it's broadly effective, the degree of effectiveness might differ.
That makes sense. Now, with any drug, we have to talk about safety. What did the research show about side effects?
Right. Safety's crucial. Apomorphine does come with its own set of side effects, and they seem to be more common at higher doses. Compared to placebo, more men stopped taking apomorphine because of adverse events.
What kind of events?
The most common things were nausea, sometimes vomiting, dizziness, and headache. Pretty typical drug side effects in a way. But there are also some more concerning events reported, though less frequently. Things like vasovagal symptoms.
Vasovagal, like fainting.
Yeah, basically. It can involve a temporary loss of consciousness or feeling faint, along with low blood pressure and a slow heart rate. These also seemed linked to the dose more likely at higher doses.
That sounds potentially serious.
It can be. And actually, in one of the studies, they had to stop randomizing patients to the highest dose they were testing, which was 6 milligrams, because of these kinds of safety concerns.
Okay, so dose management seems key here. But despite these side effects, you mentioned apomorphine has had a unique journey. It was on the market, then vanished. What happened?
Yeah, the history is really interesting. It was actually approved and marketed back in the early 2000s. It was the first centrally acting drug approved for ED.
So it was ahead of its time, in a way.
You could say that. But then the PDE5 inhibitors really took off. They were very effective for a lot of men, and the competition was intense. So the companies producing apomorphine eventually withdrew it from the market. It wasn't pulled for safety, primarily, but more due to the market dynamics.
It just got overshadowed by the new blockbusters.
Pretty much. It's been off patent for a long time, too.
So why are we talking about it now if it was retired?
Because here's the crucial point, the real kicker. Despite being retired from active marketing years ago, sublingual apomorphine is currently the only licensed oral medication for ED that is not absolutely contraindicated if a man is taking nitrates.
Oh, the only one?
The only oral one currently licensed, yes, that doesn't have that strict do not use with nitrates warning that all the PDE5 inhibitors carry.
That is a huge deal.
It is. It makes apomorphine an incredibly important, potentially life-changing option for that whole group of men we talked about earlier, the ones on nitrates who can't safely touch PDE5 inhibitors.
So this drug, which kind of faded into the background, actually holds this incredibly vital niche.
Precisely. It's a critical lifeline for a specific and significant patient population.
That's a really powerful piece of information. It just shows how complex treatment landscapes can be and how options might exist even if they aren't front and center. So if you had to boil it down, what's the main message you want our listeners to take away from this discussion today?
The bottom line is this. If you're dealing with ED, and especially if the common treatments like PDE5 inhibitors aren't suitable for you, particularly if you use nitrates, apomorphine represents a completely different approach. It acts on the brain, and crucially, it offers a path to treatment that avoids that dangerous nitrate interaction.
Really?
Knowing this exists empowers you.
Empowers you to have a better conversation with your doctor.
Exactly. To ask questions, to explore all the potential options available, not just the most well-known ones.
It's a great reminder that in men's health, digging a little deeper, asking those extra questions can sometimes uncover solutions you didn't even know were there. Don't assume the first answer is the only answer.